Hi everyone, I'm Nick Altmeyer with linkinglewiscounty.com. Here today with a special segment. I have Anna Platz with us. Anna is the Deputy Director at Lewis County Public Health. Anna's here today to kind of give us a little bit of an update on what's going on with the COVID-19 pandemic. So a lot of people we're getting back to school, we're getting back into our routines after a nice summer. So a lot of times during the summer, people kind of fall a little behind on what's going on, and a lot of things have changed as far as the pandemic's concerned over the summer. So let's jump right into it, Anna,
Sure.
and let's get right into what's the current process for somebody if they've contracted the COVID-19 virus. What's that look like now as compared to it was even a year ago?
Sure. So if you test positive for COVID-19, the way to start is understand that you're going to have a full 5 days of isolation. If, say, your symptoms started on Sunday, your isolation would start on Monday. That's going to be day one, and you'll be in isolation for 5 full days. If after you complete day 5, your symptoms are improving and you've been fever-free for 24 hours, you are good to be free of your isolation, but we do ask that you wear a mask when you're in public and around the others in your home through day 11. I know the numbers get a little wonky, but if you can kind of think of your symptom onset day as day 0, and then your next day is day 1, hopefully that will help you figure out your days. There's also a really handy isolation calculator on the CDC's website, and we have it on our site too, that can help simplify those things. If you at day 5 are not feeling better and your symptom and your fever has not resolved, or if you're still taking a medication to help with your fever, continue to stay in isolation until your symptoms have improved and you've been fever-free for 24 hours without those medications. For some guidance, if you go to lewiscounty.org, you'll see right on the homepage there's an icon that says, I've tested positive with a COVID-19 home test or any test. And if you click that link, it will direct you to a page with these instructions as well, and a form for you to submit your positive home test results so we can report as accurate numbers daily as we can. The big change, or most recent change to this process also, is that contact tracing and quarantining no longer exists. So if you test positive, the kind thing to do is to still notify those people that you've had contact with 48 hours prior to symptom onset to let them know that they've been exposed. But those people that you've exposed, whether they are vaccinated or not, their recommendation is now to test on day 6. So 6 days after they were exposed to the positive individual, they should take an antigen test, whether they're having symptoms or not. If they develop symptoms sooner than that, they should test at that time.
So it sounds like we're moving more towards personal responsibility with
Yes.
some of this stuff. So doing the right thing, if you are sick, not spreading it to other people is probably the point of the isolation.
Correct.
And just letting, maybe your coworkers and things like that know if
Yes.
you did get a positive test. So even though it's not required anymore, those are still good practices to follow.
Yes, absolutely. The CDC and then New York State Department of Health has really streamlined the isolation protocol and notifying people
Right.
of their exposures. So now you don't have to think about whether you're vaccinated or not when it comes to determining your isolation or your quarantine period. It's the same for everybody, which will hopefully help with clear understanding.
So some of the reasons that we've seen a number of changes in the guidance and things like that over the last couple of years are more and more tools have become available to us
Yes.
to help combat the virus and the pandemic. So can you talk a little bit about what some of those options are for somebody that has contracted the virus? And I think as far as like some of the treatments and therapeutics, it might be important to address that in the first couple of days of getting the virus.
Yes, you are absolutely right. So if you are someone who is at higher risk for having severe illness when infected with COVID-19, as soon as you have that positive test result, we recommend that you contact your healthcare provider and see if you're eligible for one of the free COVID-19 treatments that are available across the nation at this point. It's really, really important that if you are eligible for one of those treatments, that you start taking the medication very soon after you develop symptoms. So really, as soon as you have that test result, call your healthcare provider and they will discuss with you whether or not you're eligible for those treatments and order the prescription for you.
Okay. So speaking of vaccines and things like that, a lot of things have changed with that,
Yes.
Even recently. So as it stands right now, who's eligible for vaccines and what vaccines? Because there are a number of different ones out there.
Yes, so at this point, everyone 6 months and older is eligible for a COVID-19 vaccine. The type of vaccine that someone is eligible for depends on their age. So for those individuals 6 months to 4 years old, they are eligible for the primary series of the Pfizer vaccine. 5 to 11-year-olds are eligible for the primary Pfizer vaccine, the primary Moderna series, and one of the original boosters. When you get to those who are 12 and older, they are eligible for the primary series for Pfizer, the primary series for Moderna, one or more depending on your health of the original boosters, and now either the Pfizer or the Moderna bivalent vaccine. The thing to note for those who are 12 to 17 years old, they are only eligible for the Pfizer bivalent vaccine, not Moderna.
Okay, so I think the bivalent vaccine is the newest addition to the vaccine family.
Yes.
So did you just want to quickly
Sure.
talk about how that's a little bit different than the originals?
So this vaccine was designed to specifically address the Omicron variant. So anybody who has had the primary series of either Pfizer or Moderna is eligible for the bivalent booster. And you can call Lewis County Public Health to schedule a Moderna booster, but we are not administering Pfizer. If you would like Pfizer, you'll have to call your local pharmacy to make an appointment. But call or visit their websites. I know Kinney's has a great registration portal online where you can easily make your appointment.
Okay, and I think that brings us right into the next part as far as people. We're not really seeing vaccine clinics and things like that anymore, but public health still does have limited supplies of vaccines.
Yes.
So that's one avenue. People can call into public health and schedule an appointment to get a dose that way.
Correct.
And I think you also mentioned working with your primary providers. They might hook you up with or put you in touch with the pharmacies or
Correct.
the other people that are distributing the vaccine.
Yes, so you can call Lewis County Public Health to make an appointment for your vaccine. Or you can call your local pharmacy. If you have any questions about maybe which vaccine you should get or the timing, like depending on if you maybe recently had COVID or recently received one of the other boosters, call your healthcare provider and they will guide you as to what they'd recommend as far as timing goes. But you'll get your vaccine either with us at Public Health or at one of our local pharmacies.
And the vaccines are still being offered at no charge to people?
Correct. Vaccines and the medication treatment that's available for those who are infected with COVID-19 are still free of charge.
Okay. And I think we touched on it a little bit, but at this point, who is considered to be high risk, like a high risk individual if they contract COVID-19?
Sure. So that hasn't really changed too much over the course of the pandemic. It's those older adults, so specifically those 50 or older, and those with certain chronic health conditions like obesity, diabetes, whether someone has cancer, if you have a disability. Those higher risk populations have remained pretty consistent throughout the pandemic.
Okay. So just talking to people in general, and as we get into colder weather, people are spending more time inside, more time together inside, things like that. So not just with COVID, but what are some good common practices this time of year to avoid all kinds of respiratory illnesses, whether we're talking about flu or COVID or other things like that?
Absolutely. So staying up to date on your COVID vaccines and your flu shot, those are great practices. Wearing a mask in public, if that's something that you would like to do. Staying home when you're sick, I think we've all gotten pretty good at that, which is reassuring. Test out of precaution. If you have, at this point, the antigen, the rapid tests are pretty accessible, so testing if you're feeling not yourself is a great tool to use. And then the simple things like washing your hands, increasing or improving air ventilation wherever you can, cracking a window, things like that will all help not only keep you safe, but our community.
All right. So if you could just share with us a little bit, I know public health bases a lot of, especially locally, a lot of their guidance and things on guidance that comes from the CDC. So what are the CDC recommendations right now as far as when it comes to like masking and things like that?
Sure.
In public spaces?
Sure. So I'll start off by saying people can wear a mask at any time that they would like to. And please, if you are choosing not to wear a mask, please be respectful of those who are choosing to wear a mask. It is for their protection and others. So start off by saying people can wear a mask anywhere at any time. But at this point, masks are not currently required in public spaces. The CDC does have a like community COVID level kind of metric that they're using. So communities and counties in particular are categorized in either low, medium, or high. We're in low right now, but if we were to, or any community was to approach like the medium COVID level, that is when those folks who are higher risk should especially consider wearing a mask in public, as well as the people like in their household and close to them. It'd be great to do out of consideration for them. Once we get into the medium to high, or if we were to get into the medium to high transmission level, that is when the rest of us would be encouraged to wear a mask also. But again, those are recommendations, not requirements. And here in Lewis County right now, our COVID-19 community level is low.
Okay, so and people that want to keep track of that, that's available on the CDC website.
Yes, I believe they update
like a mapping
weekly,
and there's like a mapping feature, so you can see if we're designated low, medium, high, as you said. Low pretty much means that the level of transmission in the community is low, so there's not as high of a risk if you are out in public. Once we get into the medium and the high, that means that the virus is pretty prevalent at the moment, and take more precautions type deal?
Yes.
Okay.
Yep. But again, anyone can wear a mask at any time.
Okay. In the state, I think it was recently changed, or at least over the summer, like the public transportation and things like that, all of those aspects.
Right. So at this point, the only institutions where, or the only places in communities where masks are currently still required are in healthcare facilities. So if you go to Lewis County General Hospital, you'll be required to wear a mask. But there's also adult care facilities are still required to mask. Specialty hospitals certified by the Office for People with Developmental Disabilities, others that are regulated by the Office of Mental Health and things like that. So if you think healthcare facility, just for good frame of reference, masks are still required in an overwhelming majority of healthcare facilities. But that's the only location.
Okay. And I think, people are starting to get somewhat of an optimistic look after, a couple of years of dealing with the pandemic. Are we still in the pandemic stage with COVID-19?
Yes.
Okay. Can you just kind of explain the stages of
Sure. So COVID-19 was considered an epidemic when it was just spreading in that really centralized location in China early on. But in March of 2020, the World Health Organization declared COVID-19 a pandemic because of its it's spread. It's widespread spread beyond outside of China and then across the world. And we are still in the pandemic phase of COVID-19. It is still widespread across our community and others, and it will remain here for a bit.
Okay. As far as are we still seeing like drastic impacts at the hospital level and things like that? I know when we were checking in this morning before the interview, it looked like there are currently 4 Lewis County residents hospitalized with COVID-19, which is still a significant number based on our population.
Absolutely, we want our hospitals to be ready and able and have beds available to those who need them. So staying up to date on your COVID vaccine, wearing a mask, staying home when you are sick are all just good, safe practices that we can all do to keep our COVID, those we love, safe, and to keep our community's transmission level at a manageable way so our hospitals are ready and able to help those who need it most. Yes, 4 hospitalizations is 4 too many, but so I would just ask that we all do everything we can to make sure that our local hospital and our surrounding communities are as prepared as they can be to help those we love when they need it.
Okay, and with all the tools we have in place now and everything like that, is there still a possibility that we could see a different variant or something emerge with the COVID-19 pandemic that might change where things are at right now?
Yes, I mean, we've seen this virus mutate several times over the course of the last 2.5+ years. So there's always the chance that a new variant could emerge, but vaccines and masking, staying home when we're sick, washing our hands, those continue to be the best practices for us to be prepared for anything new that may happen.
So there's lots of reasons to be optimistic,
Yes.
But we still can't let our guard completely down.
Correct.
Perfect. Well, I think that kind of gives people a little bit of a understanding of where we are currently with the pandemic, especially here locally. I know that you guys at Lewis County Public Health have really put a lot of work and effort into everything that's been going on over the last few years. We appreciate that. Was there anything else that you wanted to add before we let you go today?
Thank you for having us and for encouraging us to touch base with the community on this again. Like we said, we are living with COVID at this point, and there's lots of tools in our toolbox so we can reduce the impact of it on our community. But if anybody has questions or is still unclear about what they should be doing when they're sick or they've been exposed or best practices, they're still welcome to call us at Lewis County Public Health at 315-376-5453, and our staff would be happy to answer your questions.
Okay, and we'll also throw up like a link to your guys' website and some other useful information where they can track the CDC stuff and see the maps and things like that as well. So you guys are still updating your data daily?
Yes.
As far as weekdays?
Yes, Monday through Friday we continue to update the number of new cases, our total COVID-19 case count, hospitalizations, and deaths.
Which I think, so throughout the entire pandemic, I think it was somewhere around 7,700 was somewhere in the 7,000s were for a total case count, and I think we've had 54 COVID-related deaths since the beginning of the pandemic. So.
Yes.
Okay. Well, Anna, again, we appreciate you taking the time to come in and speak with us today, and thank you very much.
Thanks for having me.